Happening now, the Georgia House of Representatives Rural Development Committee is traveling the state exploring ways to help grow local economies. Experts say one of the biggest barriers limiting rural development is access to health care. 41 NBC's Taylor Gilchrist went to Mercer.
The rural hospital is the economic engine of a small community. That's number one. Critical that they stay alive and stay well.
The State House Rural Development Committee is eyeing paths to economic growth in small communities across Georgia. State Representative Lisa Hagan serves as committee chair and says a big topic on the minds of Georgians is rural health care. Hagan adds with 9 hospitals closing across the state since 2010, it's making it more difficult for those communities to attract industry.
When a new employer is looking to come into any area, but particularly rural Georgia, they're looking for what their employees need to have if they're going to be asked to relocate there.
One of Thursday's presenters was Hometown Health CEO Jimmy Lewis. According to Lewis, nearly 30 rural Georgia hospitals are currently at risk of closure, with 6 being at risk of closing at any given point in the near future. He says cuts to Medicaid are fueling uncertainty.
We have to understand that absent funding, we're going to have these hospitals to close, and it's going to lock down the closure in those rural communities.
Citing cash and workforce shortages, Lewis called on lawmakers to double funding for the Georgia Heart Program, which helps hospitals and donors increase access to rural health care through a tax credit. He says not increasing these subsidies and those allocated for OBs will have devastating consequences.
And we're forced to lose a significant amount of our economic development called health care in rural hospitals and rural communities. We're creating a third world nation.
With hospitals being the largest employer for many rural Georgia communities, Representative Hagan says protecting their services is a top priority and vows to do what's necessary to keep them open.
They do struggle, but they're important and they matter greatly to the people that live in our rural communities.
The committee's final meeting will take place next month in Atlanta. Lawmakers say they'll use the information they've gathered to craft legislation in 2026. Reporting in Macon, Taylor Gilchrist, 41 NBC News.
And according to a University of North Carolina Sheps Center report, the Flint River Community Hospital in Montezuma and the Washington County Community Regional Medical Center in Sandersville are both at risk of reducing services or closing.